Land is barren. And most days he has to break off from his work. One of the women in the village is worried about her 18-month-old daughter. And for the next half hour, Sala stops being a farmer and becomes a health guide. He is one of 50 primary healthcare workers in the South Yemen and one of over 2 million now working in the developing world. His home is on the way and he needs to pick up his satchel full of basic medical equipment. These few items can cope with the common local illnesses and save lives. His practice is the village of مريب, where he has lived all his life. Until 1981, the 40 families on this hillside had no local medical help at all. Doctors and hospitals were available at Lachej or in the capital, Aden, 60 miles away. But they were beyond the physical and financial reach of village people. The result was that in these houses, 1 baby in every 6 died in childhood.
ايش في هذه البنت؟
سيلان.
يعني سهلة.
Sala knows at once what is wrong and explains to the child's mother that diarrhea is draining essential fluids and salts out of her daughter's body. Without treatment, she is likely to die within a few days. Now there is a treatment, a breakthrough which can be used at home. 4 Coke bottles measure 1 litre of boiled water. Sala adds the contents of a sachet supplied by UNICEF. It's mainly salts and sugar to counter dehydration. He explains to the parents about using boiled water and arranges to leave enough packets of salts to last until the child is better. In 1981, 14,000 children died every day from diarrhea. 90% of them could have been saved by this treatment. It costs 10 cents.
وضمن يعني هذا الكلام مش خسرنا حتى ربع ساعة يعني في العمل فيه. يعني أنقذنا حياة. لو كان يعني في الأول.
It took 15 minutes to give her the right remedy, and we probably saved her life. If it had been a few years ago, there would be nothing to do. We would have had to watch her die. That's what happened to my daughter. I wish we'd had the idea sooner. But now we are changing things. مريب was one of the first villages to try this idea of primary health care. I'd heard that the government was trying to set up something around here, but I had no idea what it was. Then I went to a village meeting called by the deputy mayor. Well, he was really enthusiastic about primary health care. He said if we waited till we could afford doctors and hospitals, we could wait forever. But we could save lives and prevent disease ourselves. The first thing was to elect one person to be trained as the health guide for the village. People were suspicious at first, but we agreed to try it, and I was elected. I was very pleased, also a bit nervous.
لما بيصب المياه هنا بتبقى الماء بينزل ويبغى الغبار هاي لا تربه في هذا المكان. معناته انه ترسب الماء هذا. ترسب طيب بعد هذا.
Well, I had to go for a training, 3 weeks training at the nearest health center. there were 50 others on the course. Ordinary people, farmers mostly, and some teachers. What was needed was to be able to read and write. They taught us straight away that a health guide must not only cure disease, but even more important, must learn to fight the causes of ill health. After the training, I went back to work. But now I had 2 jobs. You're not paid for being a health guide, so now I fit the work in with farming. In my father's time, people didn't really understand what was making so many of them ill. We used to think that water was water, and we used to drink it straight from the wadi. But people were washing, and animals were drinking in the same water. So every village lower down the wadi used to drink all the diseases of the villages higher up. So now we're digging into the hillside for drinking water and building a small reservoir. But there is a problem. In order to finish it, we need more cement. All the villages that have health guides are asking for cement, and there isn't enough to go around. It's the same with malaria. We know now that mosquitoes breed in stagnant water. But we had to wait months for sprays and insecticides to deal with them. And hardest of all is to change the way people do things. When we wanted to burn all the rubbish to prevent flies, people said, "Oh, Saleh's making more work for us. We've never done this before." So I said, "But you're getting ill, aren't you? Why don't you try this for 1 month? And if you don't see any difference, then stop." Yes, I'm always very busy. The villagers used to laugh at me. When I first went round with my bag, they'd say, he's mad. Does he think he's a doctor after 3 weeks training? Actually, I never say I'm a doctor. I say, I'm just a health guide, but I can be useful to you. The number of cases needing treatment has gone down from 100 a month to less than 20. It's been a very eventful year. When there's an emergency, you have to go at once to see what's wrong. My friend, Mohammed Saif, has a high fever, and his mother is very worried. She was right. It seemed an unusually bad case of malaria. Usually, pills are enough, but I thought that it was already too late. He needed an injection, so I decided to refer him to the health center at Mus'amir. That meant an hour's wait while the brother went on to the health center to try and get them to send an ambulance. Well, the mother was very worried about the child, that he might die, because there was only a certain thing I could do as health guide. What Mohammed needed was medical attention, and it was most important to get Mohammed to the health center as soon as possible. Well, now we have a Land Rover at the new health center. But there are no roads that way, and it's not an easy journey along the riverbed, especially for someone as ill as Mohammed. The health center is 1 hour away in the old Sultan's palace. He left Aden with the British after independence in 1967. We used to believe that if a child under 1 became ill, there was just no remedy. So people didn't try to treat babies when they were ill. The the child was left to the mercy of God. Everyone knows now that as health guides we can refer patients to doctors when we are not sure what to do. The medical assistant on duty agreed with my diagnosis of malaria, but then found that Muhammad had a lung infection as well.
Ali, right here.
If Muhammad doesn't improve, he can be referred on again to the general hospital in Aden for whatever treatment he needs. The big hospitals are all part of the primary healthcare system. They're there for everyone.
Before independence, you could probably say that it was health services for the minority, mainly those in towns. Whereas now we are looking at it as health for all throughout the country, with a particular emphasis on those in rural areas who had nothing before independence or very, very scarce health services.
Dr. Amin Nasha, Deputy Minister of Health.
People who needed to be saved didn't either have the means of transport to get to the health center or health unit, or even if they have the means, that center was not there and they couldn't get in time. And most of the cases, even those who had the means to come to the main hospitals in town, usually arrived too late. And one of the objectives of primary health care is to save people on the spot and then refer them when they're in a better position to move, if they could not, of course, be treated on the spot. The same thing with malaria. Malaria kills many, many children and adults, and young adults in particular, simply because malaria is not stable in the country. It exists with higher prevalence in some areas and with low prevalence in others. And we have been getting a lot of people dying of cerebral malaria. The same thing with the other infections, pneumonia, tuberculosis, and so on and so forth. Simple diseases which could be treated on the spot without necessarily even having a doctor. I mean, you could train anybody who could read and write and who could handle a few items of medicine, how to diagnose early and how to treat also early. Our priority is to save probably the 80, 90, 95% of the population and not the 1 to 2%. Now, that will become a priority in a developed society where they have been able to overcome all the communicable diseases, all the diseases of malnutrition, all the infectious diseases. But these are still killing thousands of lives every year, and we can treat them without necessarily having sophisticated medical equipment or even the ivory towers of the teaching hospitals. We can still treat them in tents in very, very simple health units, and that is primary health care again.
On May the 19th, 1981, the news in the village of مريب was that Mohammed Saif was home, still weak but out of danger. Without primary health care, Mohammed would probably have been one of this year's child mortality statistics. Salah Hamshali is one health guide in one village, in one country. Yet the day when every community in South Yemen has at least basic health care